All right, good morning, everyone. Our seminar presentation is on dialectical behavior therapy. The presenters are Alex Z, Delphine S, Jessica S, and Yancy L. We will be discussing in this presentation are the 7 dimensions according to Bear, Wolf, and Risley in 1968, when and who created DBT, goals and how to implement DBT, training and demographic, our thoughts, and lastly, some questions from the class. So let's begin with the 7 dimensions of ABA. Here is a gestalt of what they involve: generality, effective, technological, applied, conceptually systematic, analytic, and behavioral. The first dimension, called generality, according to published literature on hand, dialectic behavior therapy does in fact meet the Bear-Wolf-Risley 1968 dimensional criteria. Although training is first carried out in a controlled environment, the therapy should be developed in such a way that it resembles the person's natural circumstances, as this increases the possibility that behavior will generalize across a variety of settings outside from treatment and stay constant over time. This is very important. That's the first dimension. The second dimension is effective, and DBT does provide long-lasting effective results for clients upon treatment for the presenting problem, as is evident by academic literature studying the differences in clients before and after intervention. These studies also reveal how positive psychological results maintain after 6 months as well as a year post-treatment. So indeed, it is effective. The third dimension, technological, is a domain that dictates that treatments must be described in a form that clearly and thoroughly defines all of the parts, allowing anybody else to recreate it. To do this, all of the techniques that form in treatment must be explicitly identified and documented. Internal validity is at its optimum when it is simple to grasp and duplicate, showing that your intervention has been created with high fidelity. The fourth dimension is applied, and this is commensurate on competent DBT intervention designs. This step is perhaps the most nerve-wracking because it is the first dimension that immediately impacts your client, for better or worse. The fifth dimension, called conceptually systematic, is an essential question to consider because it determines whether this approach should remain true with the principles recommended to operate successfully that has been recognized by Bear, Wolf, and Risley, 1968. If it does not, then how can the logistical mechanics be changed to assure this does occur? The sixth dimension, called analytic, is behavior therapists collect information on a client's reaction to treatment tactics. Data research demonstrates clear links between certain therapies and positive behavioral changes. When evidence reveals that the expected change has not occurred, it is clear that new treatments must be considered. And lastly, the seventh dimension is behavioral. And here, ABA clinicians examine behavior patterns, then recommend behavioral improvements by providing feedback in addition to monitoring how different treatments affect target behaviors. Intervention strategies can be finely tuned to elicit the desired behavioral changes.
When and who? DBT was developed in the late 70s by Dr. Marcia Linehan. Dr. Marcia Linehan suffered from mental illness herself and was dedicated to helping others. She published her first book about DBT in 1993. Goals and how. Goals of DBT are to use a combination of CBT, mindfulness, and dialectics to help clients to convert their negative thoughts and destructive behaviors into positive thoughts and behaviors. Each stage of DBT has new goals and targets. In stage 1, the focus is on getting the problem behaviors under control and learning the skills to do that. In stage 2, trauma is the focus, dealing with the client's past trauma and emotions related to their trauma. Stage 3 focuses on living life and reaching personal goals, while stage 4 is about finding a deeper meaning of life, often spiritually.
Dialectical behavior therapy aims to touch on 4 different skills: distress tolerance, interpersonal effectiveness, mindfulness, and emotion regulation. Although these 4 skills are separate, they all connect in the individual's ability to cope with negative emotions and thoughts. Distress tolerance refers to the person's ability to cope with negative experiences when they occur and not avoid them. Interpersonal effectiveness is the ability to gain relationships, maintaining them, and gaining self-respect. This includes making boundaries, making assertive requests, maintaining positive relationships, and living by their values to gain self-respect. Mindfulness is the ability of someone to experience the present moment without judgment. This means being able to feel the current emotions, feelings, and experience without getting overwhelmed. Emotion regulation is the ability to decrease extreme emotions and learn how to cope with them. There are many ways to implement DBT. There are group therapy sessions, individual therapy sessions, and it can also be done through video call. In these sessions, they may or may not touch on all the modules. It depends on the needs of the clients, because DBT is client-centered. In the standard DBT group sessions, they alternate between modules throughout 6 or 12 months. According to Marcia Linehan's DBT training manual, each module has a set number of weeks. This is shown in this image. As we can see, orientation is always followed by mindfulness for 2 weeks, 3 times in the period of 6 months, or 6 times in the period of 12 months. Interpersonal effectiveness lasts 5 weeks, once in a 6-month session, or twice in a 12-month session. Then again, orientation and mindfulness. Then emotion regulations for 7 weeks, once in a 6-month session or twice in a 12-month session. Followed again by orientation and mindfulness, and then distress tolerance for 6 weeks, once in a 6-month session or twice in a 12-month session. There is no evidence that suggests that there should be a certain order to these modules, and modules can be dropped according to the client's needs and goals. However, mindfulness should always be paired with orientation. Just like CBT, DBT requires the clients to do homework. In between sessions, the therapist will give them handouts to follow so they can gain the skills they've learned in the session. Each module has their own handout. For example, one of the handouts for distress tolerance is called Wise Mind Accepts. This is a distracting method so that when they feel distressing emotions or feelings, they could follow this handout to successfully distract themselves. ACCEPT is an acronym that stands for activities, contributing, comparisons, emotions, pushing away, thoughts, and sensations. So, for example, when they experience negative emotion or distressing thoughts, they could look at activities and find an activity for them to do to distract themselves so they can not focus on the distressing emotion. There are many things on that list that they could do. So in between sessions, they would follow this and then talk about it in their next sessions. For the interpersonal effectiveness module, there is a handout called Dear Man. This is also an acronym that stands for Describe, Express, Assert, Reinforce, Mindfulness, Appear Confident, and Negotiate. The purpose of this handout is to help the client be assertive when making requests or bringing up situations in a relationship so that they can get what they want in an assertive way. So they would have to describe the situation to the other person, express themselves using I statements, assert themselves, and state what they want the other person to do. Then they have to reinforce the other person if they react in a positive way, be mindful and not get sidetracked, be confident when making their request, and then negotiate with the other person to find a solution. Using this handout, they will learn how to be assertive and they could talk about how it worked for them in the next session. For the mindfulness skills, they can use something called mindful meditation. They will receive a handout that tells them the steps so they can successfully do that. So they would have to sit somewhere or be comfortable somewhere quiet, focus on their breathing, focus on how it feels, the air going through their trachea to their lungs and then being breathed out through their nose or mouth. Then they would have to pay attention to the thoughts and feelings that come up when they do that, and do that in a non-judgmental way. So they could think their thoughts as an outside observer. So just objectively say, I am thinking so and so, or just say what they're feeling. For example, I feel angry, and just feel that emotion without trying to avoid it. Then when those pass, they would just focus on their breathing again and do that for 15 minutes. That is just one example of how they can be mindful in between sessions. Finally, emotion regulation has a handout called Opposite Action. This handout tells the client how to react when they feel an extreme emotion or negative emotion like anger or sadness. For example, if they feel sad, they would notice how they usually react, how they behave in relationships or something like that, and they would do the opposite of that. So for example, if they feel sad, so usually they withdraw from friends. So the opposite action of that would be to communicate with friends, have a phone call or hang out with them, and doing the opposite of the usual action would change the emotion. So because DBT is a branch of CBT, if you change the action, so you change the behavior, it will obviously in the cycle change the emotion and the thoughts. There are many other handouts for each modules. These were just examples of them, but the goal for each of one is to give the clients a set of skills so they can effectively, have distress tolerance skills, interpersonal skills, mindfulness, and emotional regulation skills. So that is how we can implement DBT.
I will talk about how to access DBT training and its ideal demographics. There are two major components regarding DBT training, which are how to get access to DBT training courses and how to become a certified DBT therapist. From a Google research, you can see that there are numerous DBT online training courses available. One that I would recommend is the DBT curriculum provided by University of Toronto School of Continuing Studies. In this program, you will learn the 4 core skills of DBT, which are mindfulness, effectiveness interpersonal skills, emotional regulation, and distress tolerance. In addition, you will learn to implement the core skills into the 4 basic models of DBT, which are create and implement of individual DBT, phone-based consultation, group therapy, and learn to plan and execute a DBT consultation team. You can start the course in the fall or winter semester each year. The program consists of 5 courses, which need to be completed within 4 years. Each course costs from $649 to $999, for a total cost $3,745 to complete all 5 courses. The second question is how to become a certified DBT therapist. Getting a DBT Lanham Board of certification requires obtaining license, doing a set amount of work experience, and completing all mandatory exams. Regarding license, you need to obtain a graduate degree within a mental health-related field. You must be a licensed independent mental health practitioner with an unrestricted license. You are also required to provide a letter of recommendation as to your character and competency as a DBT practitioner from your team leader. There are 5 different experiences required. Firstly, you are required to obtain a minimum of 40 didactic course training hours specific to DBT. You also need to have clinical experience in DBT in which you have completed stage 1 treatment with 3 clients within the past 3 years while they were concurrently enrolled in a DBT skills group. You need DBT team experiences with a total of 12 months of participation in 1 or more DBT consultation team, and current participation on a DBT team. You need DBT skills experience with borderline personality disorder, and you need to have learned and taught all DBT skills within individual therapy and coached clients. Lastly, formal training in mindfulness is required. You need to pass the exam based on the treatment manual, Cognitive Behavioral Treatment of Borderline Personality Disorder by Marsha Lanham. In addition, your work product demonstration, which are 3 consecutive video recordings of client pre-treatment sessions, needs to be approved. Your demonstration will then be reviewed and coded to evidence-based adherence standards for DBT. After you have met all these 10 criteria, you will be a certified DBT therapist. The ideal population who may benefit from DBT are both adolescents and adults who can functionally communicate. Besides being effective for populations who have borderline personality disorder, DBT also shows effectiveness for other emotional-related disorders, such as eating and food disorders, self-injury behaviors, addiction, emotional dysregulations, and gender dysphoria.
Here are our thoughts. DBT is an effective intervention that has multiple uses. Although it is predominantly known for its effects with those suffering from BPD, it is also used for those suffering eating disorders, emotional dysregulation, impulsive behavior, trauma, suicidal attempts, self-harm, and addiction. Strengths of DBT include the skills the clients learn through DBT can be used anywhere. It helps to improve relationships. DBT takes into consideration that a support system is necessary for those struggling with mental illness and incorporates a supporting approach to ensure effectiveness. Most importantly, it improves quality of life by helping clients make the changes necessary to get on a better path and supporting them when it feels overwhelming. Their quality of life improves drastically. Some disadvantages of DBT include commitment, overwhelming, homework, and religion. The weekly skills training takes commitment from the client and may be difficult to fit into a schedule. Some of the skills may appear overwhelming and may cause client to hesitate or avoid them. Many people live busy lives. Not everyone has or will make the time to do homework with such a busy schedule. Some aspects of DBT involve religion, such as finding a deeper meaning. Clients with other religious beliefs may find issue with these aspects.
Feel free to ask us any question. Thank you for being here today. We really appreciate that you took the time here and listened to our presentation. Here are our references.